All right, guys, it's time for part 2 of the Q&A, so let's get to this next question. Hi, Jason. My mom, who is 65, has retired and wants to start training using weights with my help. Do you have any advice? In general, her joints are relatively good. She is prone to LBP and pain in her right hip. All right, as she is 65, she most likely has some mobility issues, so the first things that I would focus on, rather than put her on weights at all in the first month, I would go ahead and have her start doing mobility exercises, foam rolling, third world squats, even squatting down to a box, and just body weight stuff in general. And what I would also do, because she's got some issues with the one hip, I would go ahead and have her start using light bands, maybe start with a purple band or a red band even, and have her, again, just wrap them around her knees and spread those apart, almost like the good girl, bad girl machine you see people doing all the time. So basically the bad girl machine, as people call it, do that with a band so that you can start strengthening that hip and work on all of her mobility before you put her on weights, and then have her start adding in body weight exercises or even assisted body weight exercises. She might not be strong enough to do a chin up or a pull up, but she could do them with bands tied onto a rack. Again, body weight squats, even starting with squats holding onto the back of a chair, squatting to a box to get that mobility down. Things like that are what she needs to do before you put her on any free weights. That's where I would start. Let's get everything strong, get everything mobile, get her to where she can do crunches, planks, get her core strong to protect her back, and then gradually and slowly start incorporating free weight exercises. Again, after everything else is where you want it. That hip is strengthened, mobility is good, her core is strong. That's what I would do for at least a month, and then slowly start adding body weight exercises and, again, free weights as she is able to do them safely, and you can assess that all that other stuff is ready to go. All right, next question. Hi, Jason. I hope this doesn't sound like a trick question. In one of your videos, you quoted a study where participants put on substantial amounts of muscle without training when administered AAS. However, in an earlier video about Boston, you said he's small because he trains like an idiot. Which do you believe to be true? Thanks. No, that's not a trick question at all. I think it's just a misunderstanding on my point, and that's okay. Let's go ahead and clarify that so that that misunderstanding can disappear. Yeah, they put on substantial amounts of muscle. Boston isn't small. Boston is massive. I hope no one thinks that Boston is actually small. Boston is small for the amount of gear he takes because his training is probably adding almost nothing to his size, meaning the way he trains it with such light weights, terrible range of motion, terrible form, all of that is actually probably not contributing significantly, if at all, to the amount of muscle mass he has, meaning he could probably be the same size he's at if he just came in and trained for 10 minutes once a week. Again, his training stimulation is so minimal and weak for his relative size, because again, the weights he uses with partial ranges of motion for minimal volume isn't contributing at all. His size is probably somewhere between 95% to maybe even 100% attributable to the drugs he's on and nothing else. He would probably be bigger if he trained harder and with heavier workloads and heavier weights. He would probably be actually bigger than he is now, almost certainly. So what I'm saying there is that his size is purely due to the drugs. His training probably isn't contributing significantly, might be contributing to 1 or 2 pounds of muscle that he has, if that. It's not a significant factor overall. So I hope you don't think that I'm saying he's small. Boston is big. Boston is bigger than 99% of the fitness YouTubers, actually. He's enormous. But if he actually trained with any amount of workload with the drugs he's on, he would be even bigger than he is. He is purely a product of drugs, is what I'm saying, not his actual training philosophies or what he does in the gym. All right, next question. I want to try some program like your Novice 5x5, but I train in martial arts once a week and feel sore the day after from the explosive leg and core work done in the session. So it is hard to follow a full body workout 3 times a week. Do you have any suggestions? Also, how would you enhance maximally your martial arts performance if you were in my case and have little muscle and strength? Thanks. All right, here's the problem of what you're running into. Remember, my Novice 5x5 is a maximum hypertrophy with a strength oriented aspect to it program. That's what it is. It's a maximum hypertrophy program. It doesn't leave room for you to have other real training other than some cardio and GPP work, a minimal amount, mainly being able to do some list cardio and things. You don't have recovery left to do other things on that program. It is not appropriate for athletes. It's not appropriate for someone who has other training goals and endeavors besides getting as big as possible in their first year of training. So accordingly, you're going to need to run another program. There are simply other programs you could use, or you could cut down to the cutting version of it because it cuts the workload by 1/3 on the cutting version of the Novice 5x5. That would allow you a lot more recovery room to do other things that you want to do. Your other options would be to run a more explosive oriented program. My Novice 5x5 isn't really explosive training. 5 sets of 5 with sets across isn't going to allow you to train to be explosive. So that's actually kind of a misnomer there. That is like hypertrophy level volume at that point. 25 total reps with around 80% of your max is not explosive training. Now for you as a martial artist, no, I wouldn't run the novice program at all. I would look closely at what I put out a while back. If you guys remember, I made a long video about the top 5 exercises for power, strength, size, explosiveness, all of that. If you guys recall, go back and watch that video. I would, as a martial artist, I would run a program based upon beltless deadlifts, front squats, push presses, maybe power cleans, weighted chin-ups, weighted dips, things like that. That is what I would recommend that you do. Weighted body weight exercises and explosive full body movements. That's how you need to train for martial arts. And can you still get big doing that? Yes. Are you going to get quite as big as fast as you would on the novice program? No, you might only get 80 to 90% of the results you would get in terms of size, but you're going to be a lot more explosive. You're going to be stronger. You're going to have better carryover to your martial arts. So if your martial arts is important to you, then your weight training needs to reflect that. You need to go to explosive full body style training movements that actually are in the explosive range in terms of the weight, the workload, everything else. You need to be doing triples, not 5 sets of 5. You need to focus on, again, exercises that are going to be more explosive: push presses, beltless deadlifts, front squats, all that stuff, power cleans. And again, body weight exercises in general are always going to carry over really, really well to martial arts. If you're going to do volume, maybe doing your volume with body weight type movements might be a better idea for your overall size. So again, higher volume with things like chin-ups, dips, glute ham raises, things like that. And then everything else needs to have an explosive component. That's how I would train someone who wanted to get really good at martial arts, but still wants to get bigger. That's what I would recommend. Definitely not the novice 5x5. All right, next question. Can Pendlay rows add muscle and strength to your posterior chain? I ask this because there is no eccentric part of the movement, and of course the eccentric part of a repetition is what tears muscle fibers open and consequently forces them to grow back even bigger. All right, a couple points need to be addressed here. Number one, eccentric reps are not essential for size. This has been proven repeatedly. They're a very useful tool for gaining muscle mass. They're one of the tools in your toolbox. You can get big, you can get very big without ever doing a single eccentric rep in your life. So that myth needs to be thrown out. They're just a very useful tool for doing so, while if you want to reduce total training volume and still get maximum size, eccentric reps become a helpful tool. They absolutely are not required for maximum size, though. They just let you do so with less training volume. The other thing that needs to go away, this whole idea that you're tearing muscle fibers or tearing them open, that is not true. That is a garbage myth that needs to go away. What you see with some eccentric training is you see micro tearing in the connective tissue around bundles of muscle fibers. You're not actually tearing the muscle fibers themselves. When you tear muscle fibers in any significant amount, you will need to go to the emergency room. It doesn't mean because you've torn a muscle off the bone, but that tearing, you will see it in your urine. This is a medical condition. In fact, I need to address this more in the future so people understand it, because I'm going to mispronounce it wrong. It's called like rhombidosis or something. I'm saying it wrong. I'll have to look it up later. That is actually, you'll know that you have it because your urine will turn dark brown after your workout. An hour or two after you train, your urine will be dark brown or bloody. You'll be either peeing blood or rust-colored called urine. And if that happens as a result of training, that's what happens when you actually tear muscle fibers, and you need to go to the emergency room because you could die from this. This is actually a dangerous condition. So no, you're not tearing muscle fibers through your training, and if you are, it's actually a problem and it's harmful to your health, and it could kill you or injure you permanently. So you need to go to a medical doctor if you see signs that you have actually started tearing muscle fibers. And this happens a lot in some sort of sports. Some athletes experience this, and some people in CrossFit, they experience this also as a result of too much training load or working out in one session. So this is not desirable. You're not tearing muscle fibers when you train in the gym with any sort of reasonable program. All right, next question. Are bench dips bad for your shoulders? For those who don't have a dip bar, also are upright rows no higher than the nipple height bad for the shoulders the way common upright rows are? Honestly, it really depends on the bench dips. It's going to depend on the person and whether you feel a strain in your shoulders or not, and how deep you're going. If you don't have access to dip bars and you have access to competent spotters to put plates on your lap, the bench dips can be viable. But again, it's all about hand positioning. You need to keep your hands really, really narrow if you're going to do them, which means all the way pretty much touching your side so that you can get almost like a close grip bench. So you want them no more than shoulder width. And that way you can keep them tucked. So you need to be able to keep the elbows back and not flare out if you want to protect your shoulders on this exercise. You need to have a competent spotter or two who can grab plates and stack plates on your lap and take them back off if you want to do this safely without risk of injury. And is it a viable exercise? Yes, absolutely. It's just difficult to get it loaded up enough for it to be an effective exercise. And like with any other pressing movement for the chest or the shoulders, particularly other chest movements, you need to be able to keep those elbows tucked. And by keeping your elbows all the way back and your hands in narrow, fingers forward, and the palms fairly narrow behind you, you can achieve that. But it is important that you do that if you want to protect your shoulders on a bench dip. And again, competent spotters are going to be a requirement on this exercise. So it does require a little more finesse, but it can be done safely. Now, as far as the upright rows, yeah, we do know the higher you go on an upright row, the more detrimental it can become to the shoulder. But the thing that you need to consider with that is you're always taking a risk on like the glenoids in your shoulder joints by doing that, because you lose the ability to put your hands into a better position when doing upright rows like that. The best way to do it, if you really want to minimize the risk to your shoulder and you're never going to take it away completely, is going to be to maybe use a cambered bar so that you can get your thumbs turned forward a little more using a cambered bar. Because the thing is, having that pinky up, like a lot of bodybuilders recommend, like pouring out a teacup is the way they describe it, like pouring a kettle or a teacup. That's actually what damages your shoulders on things like side laterals. And if you look at your hand position on upright rows, it almost forces that. So the only way you might be able to offset that a bit is to, again, use a cambered bar so that you can get the thumb forward a little bit. And you need to keep the actual range of motion shorter, which means no higher than nipple line. But the thing to keep in mind there, if you choose to use an upright row at all, you need to look at those factors. You should probably use a fairly wide grip where you can keep the thumb out further with a cambered bar, watch the hand position, and if you feel any pain in your shoulders at all, your shoulder joint, you should probably discontinue the exercise anyway. I don't necessarily recommend the upright row due to the risks, but if you're going to insist on doing it, those are the rules I would implement. All right, next question and last question of the week. When trying to lose weight, should you focus on your weekly average or pay more attention to your best lows? All right, good question. I guess it depends on, are you trying to feel good and feel productive about your weight loss, or are you trying to actually get an accurate measurement of maybe tissue lost and what's going to stay lost when you return back to maintenance? Well, if you're trying to feel good and just feel like you're making progress for motivation, look at the weekly lows. And some people need that. That actually is what they need to feel like they're motivated. And you can track both if you want. But what I would keep up with, if you want to actual tissue loss, rather than shifts in water weight, you should probably keep up with your weekly highs or weekly average. Meaning the highest that you weighed each week is going to determine kind of how much tissue you've lost. And the reason for that is that you always lose water weight initially when you go on a cut. Any caloric deficit is going to cause some water weight loss. but your weekly highs are going to indicate a closer amount of fluid balance to where you started. So therefore that's going to give you a little more accurate representation of actual tissue weight lost for when you go back in a calorie surplus, because usually you were in a calorie surplus when you started. Whereas, and if you want to know more at maintenance, again, your overall averages for the week might give you a better idea. So again, this depends on people who are doing a more slow, careful weight loss protocol. If you're doing fairly rapid weight loss, or you're doing something like a ketogenic diet, you're always going to be down a little lower on water weight no matter what. But people who are doing a more balanced diet approach, who are losing weight slowly, I would say that the weekly average is going to give you a better idea for when you're at maintenance calories. The weekly high is going to give you a better idea of what your body weight's going to be at when you return kind of to a small calorie surplus. The weekly average will give you at maintenance, and the weekly low is again just tracking net loss, including water at your lowest, which can be just good motivation. So really it depends on what you're trying to accurately measure. But at the end of the day, if the scale is going down on any of those, then you know you're at least losing body fat. So again, it depends on what you really want to measure when you're trying to decide which one of those you want to keep up with. And it's not a bad idea to keep up with all of them, just in general, just understand what each of them actually means. All right, guys, but that's really all I have to say on that today. I hope it's been informative, and I will talk to you guys next time. Hey everybody, it's Jason Blaha here, and it's time for part 2 of the Q&A, so let's get to it. Hey Jason, how would you work the push press in as a replacement for the overhead press in a program with high squat frequency such as Texas method? You mentioned before that this could be a problem for the push press. Is the Texas method even considered a program with high squat frequency? Yeah, the Texas method has a pretty high squat frequency. I wouldn't call it really high, but it's fairly high. The main issue though you're looking at is more the volume, like the frequency and volume combined is a problem when you start putting in the push press. If you're replacing the strict overhead press with the push press in a program that has high volumes and frequency of squatting, that's really your problem, because it puts a lot of extra recovery and work and explosive training onto your legs. And if you're doing a lot of squat volume, that can be problematic for recovery for a lot of people. So, but with something like the Texas method, you're probably okay switching it straight across. What I would look for is extra soreness in your legs, problems not being able to follow the progression in the program the way it's written, and particularly on the push press and the squat, because you're not recovering, the legs aren't recovering enough from what you're doing. And if that's the case, you might need to try to reduce the squat volume just a little bit to compensate. The frequency should still be okay. It's just that the total volume and workload sometimes can be problematic. Or in some cases, if that's what you're doing, you might have to slightly reduce the progression rate on the squat as well. But generally, reducing volume is going to be your main go-to for that, as far as just facilitating the extra recovery necessary. Because the thing that you need to remember is that if you're already squatting at a decently high volume and frequency, you're probably going to get the additional leg stimulation from the push press that you might have been getting from the extra volume from the squat. So at a certain point, you can afford to reduce the squat volume just a little bit in a program to facilitate using the push press. Because again, you have to remember the push press isn't thought of as a primary lower body exercise, but it does add explosive training and workload to your lower body. So if you think of it as an assistance exercise for your squat, it should be clear that you can actually replace some of your squat volume with it and still get some benefits, some additional leg stimulation as a result of it. And that might be the best way to recover from it. Just remember, it obviously isn't going to replace the squat for you in an athletic program, but it can replace some of the squat volume and still get the same extra metabolic fatigue and even the explosive training that you would have gotten from the extra squat work you're doing. So it's just a matter of balancing these things out and understanding its role as an accessory to the squat movements, and realizing that you might have to slightly reduce the volume and workload on the primary exercise to facilitate the recovery from the additional assistance exercises. And just look at it from that perspective. All right, next question. Do you feel that males physically peak in their late 20s, a compromise between youth hormones, muscle maturity, and training knowledge? I haven't made any muscle gains since my mid-20s. Should I still be making gains in my 30s? Or is the reality we just try to hold on to what we can as we age? Even one of the most gifted lifters I know, who was benching 187 kilos age 26, now at age 35, he can just hit 160 kilograms on a good day. Yeah, this is one of those questions that almost deserves its own video. I will probably revisit this coming up here soon just because the question is fantastic. So yeah, I might screenshot this for its own video later, but the truth is, for a lot of guys, no, you're not going to be able to progress in your 30s. A lot of guys can if their lifestyle and their hormones allow for it. Meaning, if they peaked in their 20s, because you're going to peak in your 20s. If you start lifting when you're 18 years old or younger, you're going to peak in your mid 20s. Guys need to understand that. Drug-free gains slow down year after year after year. They have diminished returns year after year. You're going to be lucky to get 50% of the gains you got the year before. Well, if you make gains for 5 or 6 years straight, everything is going to slow down. You reach your 30s and your hormone levels start going down a little bit. Your connective tissue starts slowing down in its recovery a little bit. You're going to struggle to make any gains. That's just normal. But the thing that you have to realize, 160 kilogram bench press is fantastic for 35. That's downright amazing. So when you look at it from the perspective of, yes, an athlete who or lifter who peaks in their 20s and who got brutally strong and put on a lot of muscle, if they can keep 95% of what they had in their 30s, they're still going to be in the top 1% of lifters in their 30s. So the way to look at it is, yeah, guys who start later are still going to progress further then, but guys who choose to stay drug-free, particularly guys who don't go on TRT into their 30s, yeah, you might regress a little bit in your 30s. But if you reach pretty much your maximum and your peak in your 20s, and you can still maintain the best possible in your 30s, even if you're not making gains anymore, you're still going to be bigger and stronger than 95% of 20-somethings who work out in the gym. You're still going to be better than them. They're not going to be able to hang with you. So is it really that big of a deal if you regress a little bit as you age? Not really. Now, are a few people so genetically gifted that they will continue to make progress in their 30s and 40s, even if they did amazing all through their 20s? Yeah, but they're genetic outliers. They're statistical outliers. Are guys who go on pretty hefty doses of drugs going to be able to surpass that? Oftentimes, yes, unless, of course, they use similar amount of drugs in their 20s, and then they might find that they're still going to regress a little bit. So it's going to vary a lot from person to person. But if you peaked in your 20s, which is normal for someone who started fairly young, and you peak in your mid to late 20s as far as your strength and muscle mass and everything, even if you regress a little bit, you're still going to be healthier, fitter, stronger, bigger than most people who work out. So is it really that big of a deal? Not really. You're still kicking ass, so who cares? All right, next question. Do you think drug-tested athletes will ever get advanced enough that nobody can get around it? And would that be a good or bad for sports? All right, do I think it'll ever advance to that point? Probably not, because any technological advances that go towards drug testing will also be at similar levels of technological advances and medical advances that could be used by medical doctors and scientists who help the athletes beat the test and who develop new drugs for them. So is it possible? Yes. Would I bank on it? Probably not. I think it's more likely that people will always stay ahead of the testing. And to answer the other question, this will actually further cover my answer to the first part. Is it a good or a bad thing for sports? I think that for sports itself, as far as keeping people interested in sports and having an actual audience and fan base, I think successful drug testing is the worst possible thing you could do to keep sports alive. People will go back to performing inferior to what they are right now in every single professional sport in the world. Nobody wants to see people run slower, jump shorter, lift less weight, run out of steam faster, or perform lower than they were doing 20, 30, or 50 years ago. No fan wants to see that. You want to kill sports? You want to have people walk away and say sports suck and they don't want to watch this shit anymore? Have everybody stop performing as well as they were doing 30 years ago, which was all drugs. It was obviously genetics, training, everything else, but drugs played a role in that. You take those people off those drugs and all of a sudden no one performs like they were doing during people's childhood or during their father's childhood. Do you think anybody really wants to watch that? No, you will kill sports dead. That'll be the end of it. No one's going to care anymore about sports if that happens. Everyone wants to see supermen and superwomen. They want to see freaks. They want to see people who can run faster, jump higher, and play longer than anyone has ever done before. And since our genetics are the same, and we've already had selective breeding programs for this, actually in some cases all the way back to the ancient world, the genetics aren't going to improve. Our training knowledge that we obtain at this point in every generation yields us such a small difference that it's barely statistically significant. It's there, but it's tiny. It's microscopic fine tuning at this point. So the only answer for people to continue to do that is going to be stronger drugs. And actually getting rid of the drugs that set all those old records is certainly not going to help people set new ones. So, no, it's the worst thing in the world for sports. And accordingly, since there's a lot of money and a lot of political influence involved with sports, I think that political influence and that money is going to affect the quality of the testing methods, and it's going to affect the availability and the research money that goes into making sure that the drugs exist that athletes can pass with. So that stuff is going to have a twofold impact on that as well. So it's not just going to be about the latter. The people who have money and influence involved in sports know it would kill sports. They have to know it would kill sports. They're going to make sure that athletes are going to continue to perform well enough to draw in an audience and keep an interest. And anyone who thinks otherwise is being incredibly naive. All right, next question. Any advice or cues to help incorporate upper back rounding in the deadlift? I used to pull with straight back and have a hard time actually rounding it now when I want to. Thank you for this one. This is going to be the easiest question I've had all night. How to get upper back rounding or thoracic rounding. Keep your neck neutral and keep your chin pointed down at the start. And so keep your chin pointed slightly down. Keep a neutral neck and do not let your neck move at any point during the deadlift. And you will find that thoracic rounding will become immediate, and it will become easy, and it will become second nature. It will just happen automatically once you get to a heavy weight if you can do that. So chin down slightly, keep your neck neutral. Imagine there's a steel rod through your neck. If you still bend your neck, imagine there's a titanium rod through your neck. If you still bend your neck, have someone who's spotting you slap you every time you bend your neck. And about the 5th time they slap the shit out of you, you'll stop doing it. That's a bit of a joke, but I had to do that with a friend of mine, as he actually asked me to. And after about the 3rd time I slapped him, he quit doing it. So that's your solution if imagining a steel rod through your neck doesn't work. But your neck shouldn't be bending on your deadlift. And if you can keep a neutral neck and your chin down slightly, you will find thoracic rounding just happens automatically once you get to a substantial enough weight. All right, next question. Is there any benefit to stretching in terms of recovery and so on, be on the point of being flexible enough for the lifts you are doing? God, I got tongue-tied there. All right, that depends on how flexible we're talking about. I would say everyone out there, for overall health and health of your joints and your connective tissue, you need a baseline level of flexibility that can be obtained with stretching. It's not a very large amount, to be honest, so it's not a huge amount. And as far as the rest goes, the rest is going to be very sport specific and activity specific. You need to personally analyze the various activities that you're going to partake, your weightlifting, any sports that you play in, whether recreationally or competitively, and any strenuous physical activity that you do. You need to assess the amount of range of motion that you need for that, and stretch and do mobility work only to the point that you need to keep your joints and connective tissue healthy and to not pull anything for the physical activities that you personally partake in. And the reason I state that it needs to be specific, there are many physical activities, including sports, again, both recreationally and competitively, that hypermobility will reduce performance and increase your chances of injury. So you need to figure out how much that is. If you're going to do barbell squats in competition, you need to find out how deep you need to go, and don't worry about being more mobile than another inch than that. Shoulder mobility is an even bigger one. You need to find all the activities that you do, whether it's golf or baseball or rock climbing or whatever activities that you want to partake in, and you need to find out how much shoulder mobility you need by looking at those activities, photographing them, feeling yourself through those ranges of motion, and develop a strength mobility and even stretching to that range of motion and just a hair further. Because again, on anything that requires an explosive movement, like such as a golf swing or a pitch or a throw, hypermobility can actually injure your shoulders when you're swinging or throwing something with maximum force as hard as you can. So again, there's very much such a thing as hypermobility for very active people that you do need to be aware of. So yes, you need to stretch up to the point that you need for all of your activities And that is what's going to keep you healthiest. It's about not getting too inflexible, but not having hypermobility either, because too much either direction beyond what you need for your activities is what predisposes you to injury. And I don't mean with just weight training that you shouldn't train most of your stuff through a full range of motion, because that will keep your joints healthy. But you do need to be aware that there is such a thing as hypermobility for a lot of activities, and you're going to have to assess that on a case-by-case basis. And you'll probably find whatever activities you train in specifically or are going to do, that there will be guides out there of some type to help you find roughly what you're going to need there. There's a lot of material out there, but you do need to make sure that you kind of have the right ranges. You don't want to be too far either direction. Now, most people are going to be too inflexible, and that's often the case, so that's why stretching becomes such a big deal. But people who train regularly, oftentimes that completely goes away, and they don't need to worry about additional mobility once they've established a good baseline. And so once you get to that point, you do need to assess it on a case-by-case basis. All right, next question and last question of the week. Do you think new body technology such as augmentations will have an effect on competitive sports or sports in general in the future? I think the answer is absolutely yes, 100% chance this will happen in the future, barring some sort of technological bottleneck that sets us back generations or puts us into a new dark age. Barring something like that, at the rate technology is increasing, the interest in cybernetics and various augmentations, yes, I think surgeries, augmentations, and cybernetics are going to become a factor in sports in the future, very possibly within our lifetimes. I would bank on it happening in our lifetimes at this point. And when that happens, who knows how extreme it's going to go? That part, I don't think any of us could predict. It could go as far as our wildest imagination allows and maybe even further, but it might also be kept in check to some extent by regulations and rules. I suspect that once this starts to become an issue in sports, we're going to see rules written in sports, and I think you're going to start seeing individual divisions that are going to be something like all human versus cybernetic divisions and augmentation divisions like that. I think it will probably go that way one day, just like we have raw versus equipped powerlifting and some hybrids in between. I think you're going to see a lot of that in sports. What is that going to do to sports in general? Which one is going to be more popular? I really can't say, but I'm going to guess, knowing human nature and knowing how people want to see the limits pushed, I have a feeling that if that happens, that the cybernetic enhanced sports are probably going to be more popular, and I think they're probably going to be a lot more popular with younger generations, with younger sports fans. Just due to the progressive nature of it. That's what I think is going to happen with it. But, what's really going to happen, we'll have to wait and see. Is it a good or a bad thing? I really don't know. But I would lean in the direction of it being a good thing, as long as it doesn't hurt us as people in the long term. All right, guys, but that's really all I have to say on that today. I hope it's been informative, and I will talk to you guys next time.